once again to Church Alive. And this is your host and president of Church Alive Development Corporation, Reverend Dr. Timothy Burkett, also the proud pastor of Church Alive Community Church. And once again, we're happy to bring you Ask Dr. Tommy O. And so without any further ado, we're going to ask Dr. Tommy O. Dr. Tommy O, welcome to Church Alive. Amen. Partners in the ministry. Amen.
Thank you.
We thank God for all the work that you have been doing for our parishioners and our neighbors and our friends. It's just been great as we bring to them a holistic approach to the gospel. And we have a very special guest, a young lady with us today, and would like you to introduce her to us.
Yes, I have my student, a student from Mercy College. Her name's Jeanette Villeneuve. She's here, she's a student, and she's training underneath me. You know, introduce.
Good. Welcome to Church Alive.
Hi,
okay?
Nice to meet you.
Okay. All right, we're going to deal, and we're going to come back to you, so you stay right there. But we're going to deal with hypertension, because many people, and I've been looking through some of the reporting and the research that I received from you, I'm overwhelmed by how many people in this country are suffering from hypertension. But I guess we must ask the question, what is it?
Right. Well, before I get into the hypertension, I just want to go over one thing. Like we promised at Church Alive and Dr. Paquette and myself that we would provide a top-notch show. And this particular show today is on hypertension. Let's define hypertension. Hypertension is also called high blood pressure. So if you hear those names interchangeable, it's exactly the same. So that's important to know. High blood pressure or hypertension, that is defined as high blood pressure, a reading 140/90 or greater.
Okay, now, but how do you diagnose that?
Okay, well, in order to diagnose hypertension or high blood pressure, classically, what we do is we do 3 consecutive blood pressure readings, and the reading would be, again, greater 140/90, and that would be the definition of hypertension or high blood pressure.
Okay, so if a person went in and they had one reading, that would not be sufficient.
No, not necessarily. Yeah. Again, each patient is different and unique. What you need to do, or the physician like myself, I would use my clinical judgment, and I'd look at the person. I have to see their genetic makeup, how compliant they are, their age, their family history. So it's more than, it's complex. It's not that difficult, but it's just not one step. I have to make it, thorough. Again, like I've always said every time on the show, take a thorough history and physical, and then make a clinical judgment, and then we make a decision from there.
How common is hypertension?
Hypertension is extremely common, and it is estimated that 1 out of every 4 adults in the United States suffers from hypertension. It's estimated about 50 million Americans have hypertension, and we are estimating that it's much greater than that because there's a large percentage of the population that doesn't seek medical help, that has hypertension, and that doesn't even know that they have hypertension.
Well, a lot of people will not go into the doctor unless something's wrong, unless they're sick. But what are you saying to our audience now with this massive problem of hypertension? What should they do besides waiting to be sick?
Right. Well, as patient advocates, like I stated earlier, we're here to provide a service, and we're patient advocates, and this service is to provide knowledge through enrichment and to give you the knowledge and to be proactive, to seek out help. Go to your physician, do a thorough history and physical, an annual physical, which includes blood work, a physical exam, and then if you're over a certain age, get a baseline EKG as well. If you don't have a physician, you can come and see me, and we'll have the address on the screen, and we can make a phone call and set up an appointment.
Very good. Now, there are risk factors associated with hypertension, and I think we need to look at them because some people are doing things that are very detrimental to their health. They don't realize it. And just take alcohol, for instance.
Right. We have what we call risk factors. We have modifiable and non-modifiable risk factors, and I'll break them down. The risk factors, what they are areas that increase the risk of developing hypertension. In this particular area, you said alcohol. Alcohol, we don't know the exact reason why alcohol raises the blood pressure. at least documented in the books. However, with excessive alcohol use, there is a tendency for the blood pressure to increase. And that would be a modifiable risk factor, meaning that we could modify our alcohol intake, therefore reducing the risk of developing hypertension.
Now, we have a cultural situation, too, when it comes to hypertension. And I understand that African Americans, and is there any really reason why?
Right. Well, again, hypertension affects all classes, all races. However, there are certain classes and races that have an increased risk, again, a risk of developing hypertension. In this particular case, the highest risk or category would be Afro-Americans. And I think it's, based on the studies, it's suggested that it's cultural, it's socioeconomical as versus knowledge-based. And what I mean by that is, we'll break it down. Socioeconomical, the lower the socioeconomical the person or the individual is on the chain, there is a decreased knowledge base as well as access to medical help. So again, if we're going to...
so it's not all just what they eat.
No, well, that's part of it. Okay, that's part of it.
Also education.
Yes.
Is medical services available to them?
Yes.
Things like that.
Right.
All right. In other communities, they have better education on these areas. And,
they do.
And
yes.
the medical services are more available. Is that what we're saying?
Yes. And going back to, because everything ties in together. It's layered. It's multi-layered. It's not, again, it's simple, but it's complex, but it's very simple. However, it's difficult. The socioeconomical situation affects the knowledge base, but also affects the way we eat. When we don't have the money, the financial resources, you're not going to eat the best foods.
That's correct.
You're going to end up eating out.
Yeah.
Instead of going out and preparing your own foods, you might have
Fast
your own.
foods.
Yes. You might live in a room, not an apartment. So if you're sharing a room, you don't have access to a kitchen, so you have a tendency to eat out. Well, these foods are usually high in salt, high in fat, high in cholesterol. That's going to raise your blood pressure and eventually give you hypertension.
Okay. Now, diabetes and also family history.
Yes.
I'm going to go a little bit into that.
Okay.
Risk factors.
Diabetes would be a modifiable and also non-modifiable, and we'll go over both. Modifiable would be a type 2 diabetes where it's based on obesity. If we're able to control your weight, we're able to control your blood sugar, theoretically we can help reduce the risk of developing high blood pressure. If it's a type 1 diabetes, usually it's genetic, where you're receiving insulin, it starts at a very early age. It's non-modifiable because we cannot change the genetics or your family predisposition. If you have the gene to develop diabetes or the gene to develop hypertension, we cannot control that. That's what you're born with. As for family history, again, you cannot modify your family. We cannot pick up parents. We cannot change your genes. Those are non-modifiable. However, we can adjust the so-called modifiable risk factors, and that's where we focus our emphasis on.
And when you start modifying, let's look at the area of excess salt. And this is the area of modification that you're talking about, right?
Yes.
Explain excess salts as far as our diet is concerned, high intake, and leading into lifestyles. Right.
Again, it boils down to lifestyle, as you mentioned.
Yeah.
Very important, lifestyle. Diet modification, lifestyle modification. When we're talking salt, or you see sodium, very important that when you look at the, like a can, you look at the ingredients, it won't say salt, it will say sodium. So that's an important point, very important. Sodium